Come on in.
Hello, my name is Jasmine. I'm going to be your nurse doing your focused musculoskeletal assessment today. How you doing?
I'm good. And yourself?
Good. Can I have your first and last name?
I'm Brody Henry.
And your date of birth?
9/16/92.
Perfect. And I'm just going to close the door for some privacy, do some hand hygiene. Is it okay if we film our session today?
Yep.
Perfect. I'm just going to ask you a few questions before we get started. Any history of any present illnesses today?
No.
Any pain?
Nope.
Any changes in your motor function?
Nope.
Any alterations in sensation?
No.
Any difficulty walking?
No.
Have you had any past musculoskeletal traumas?
No.
Any surgeries?
I had left knee surgery for my ACL.
What happened?
I tore it playing basketball back in 2011.
Ouch. Does it cause you any pain or discomfort now?
No.
Any limited range of motion in that knee?
Nope.
Any impaired senses, like any difficulty with your vision?
No.
Any difficulty hearing?
Nope.
Any past medical conditions like diabetes?
Nope.
Cancer?
Nope.
What about any neurological disorders? Any confusion, seizures?
Nope. Good to go.
Any osteoporosis?
Nope.
What about any skeletal deformities?
Nope.
Any present scoliosis?
Nope.
What about any congenital abnormalities?
Mm-mm.
No?
Not that I'm aware of.
Okay. Do you take any medications?
Nope.
Any over-the-counter medications?
No.
Do you have any allergies?
Nope.
Any medication allergies, food allergies?
Negative.
No. For your family history, for both living and dead relatives, any history of cancer?
My mom had melanoma skin cancer.
Did she get it removed?
Yeah.
Do you know approximately what age she was when she got it removed?
In the late 30s, early 40s.
How old is she now?
56.
Any other family history?
No.
Any genetic or hereditary disorders?
No.
Congenital abnormalities?
Nope.
Nope. Okay. Can you describe your family for me?
As far as what?
Brothers, sisters?
I have a sister.
You have a sister? How old is she?
28.
And no past medical history for your sister?
No.
How would you describe your home unit?
I live with my girlfriend.
What do you do for work?
I dig holes in construction for Southwest Gas.
Any issues functioning at work?
No.
Do you have any safety precautions at work that you follow?
Wear long sleeves, sunscreen, and steel toe boots.
Okay. What kind of hobbies or activities do you like to do?
Golf, snowboard, travel.
Have you had any activity intolerances with those activities?
No.
How would you describe your nutritional status?
Fairly well.
Do you eat a specific diet?
Whatever my girlfriend cooks me.
No limitations for
No.
your diet? Any recent weight changes?
Nope.
Increase in your weight, decrease in your weight?
Pretty much maintain the same one.
Good. Do you smoke at all?
No.
Any recreational drugs?
Nope.
Do you drink any alcohol?
Yeah.
Beer, liquor, wine?
A little bit of all of them.
Well, about what age did you start drinking?
21.
21. How often do you drink?
One a day.
One a day. Okay. I'm just gonna do a little quick review of systems. For general, no fever.
No.
Any chills?
Nope.
Fatigue?
Nope.
You said no weight loss, weight gain?
No, ma'am.
Okay. Any difficulty breathing?
Nope.
Chest pain or pressure?
Nope.
Any palpitations in your heart? Any feelings of fluttering?
Nope. Good to go.
Any changes in sensation? Warmth, cold?
Oh, no.
Any decreased sensation in any of your extremities?
No.
Any dysfunction in your bowel pattern?
No.
How often do you use the restroom?
Once or twice a day.
Once or twice a day. Any bladder dysfunction?
No.
Any frequency urine incontinence?
No.
Okay. Next, we're just going to start with the shoulders. So I'm just going to have you take off your shirt for me. I'm going to start with the anterior and posterior inspection of your shoulders. So looking at the general contour, noting the scapulas, making sure that they're symmetrical, looking at any lesions, any deformities of bilateral shoulders. Making sure to look at both deltoids. I'm gonna start palpating at the sternum here, going down the clavicle to the AC joint, and then palpating down the trapezius onto the scapula. Palpating the insertion site muscles, the deltoid down to the humerus. Do the same thing on the other side, starting at the sternum again, doing down the clavicle, the AC joint, and deltoid muscle, going back here to the scapula. Palpating those rotator cuff muscles and the insertion sites. Going down to the humerus. Palpating for any masses, and then we could also externally rotate the patient's arm to feel the bicep tendons. All right, and then we're just gonna start doing some range of motion exercises. I'm gonna have you just lift your hands over the top of your head for me, as far back as you can go, and then go down and go behind you. Perfect. And then lift your hands over your head, cross over, and then go down. Cross over in front. Perfect. And then next, I'm just gonna have you hold your hands like this, externally rotate, and then internal rotation. Perfect. And then next, we're just gonna test for accommodation. So we're gonna have you externally and internally rotate with abduction and adduction. So come over up top behind your head, and then reach over and behind your back. Perfect. And then have you flex for me, flex your biceps. Perfect. And then hands out in front. Push against me. Perfect. Pull. Perfect. Awesome. Next, we're just going to move down to the elbows, looking at the contour, noting any swelling or nodules of bilateral elbows, any nodules, masses, and then palpate of the medial epicondyle and lateral epicondyle, the olecranon process, the palpating the bursa and insertion sites on bilateral elbows. Perfect. No pain or tenderness in your elbows?
No.
Okay. For the range of motion, I'm just going to have you put your arms out in front of you, palms down, pronation, and then supination. Put your palms up. Perfect. Next, we'll just have you do your wrist, hands, and fingers. So I'm just going to inspect the palms, hands, look at capillary refill, note the color, temperature. Perfect. And then looking at the fingertips as well, the nails, and then some sometimes patients will have some ganglionic cysts here in their wrists, just to inspect and palpate for masses on bilateral wrists. I'm just going to palpate both the radial head and the ulnar head, the phalangeal joints, and then patients, what's called the snuff box right here. There's the scaphoid bone underneath here that has a single insertion site, that if there was any trauma to it, could cause necrosis of that bone fairly quickly. Perfect. And then for the range of motion, I'm just going to have you have your hands out in front of you. We're going to go down, up, flexion and extension, and then adduction and abduction. Perfect. Okay, for the hips and pelvis, I'm just going to inspect posture, gait, and then do inspection of the anterior, posterior hips. Pelvis, noting any asymmetry of the iliac crest. Take a look up here, posterior. I'm just going to move this down just a little bit. Just take a look at posterior. And then for palpation, kind of go down here a little bit. Feel the posterior iliac spine. Any pain or tenderness?
No.
Opposite side. Feeling the insertion sides. There's a big bursa back here for an insertion side. Okay, next for range of motion, I'm just going to help you here. Can I have you lift your leg out to the side? Perfect. Come back, and then other side. Awesome. And then can I have you put one foot in front of the other? And opposite side. Perfect. And then next, put the leg straight out in front of you. And then come up behind. Good. And then other leg. Good. Perfect. And then you can sit down. Next, we're gonna do the knee. Looking at bilateral knees for inspection. Looking at the color, any swelling, deformities. Looking at the contour of the patella. Gonna start for palpation. Anteriorly down the patella. Can feel some hardware from your ACL repair.
Yeah.
Going posteriorly, feeling the tendons. Good. Move on to the other knee. Down the tibia. Going posterior. Feeling the tendons again. Lateral. You can feel the popliteal pulse. Good. For range of motion of the knee, can I just have you bring your legs up or your knees up? Good. And then extend down, back. Good. Next, we're just going to do bilateral feet and ankles. I already looked at the gait, but look for any swelling, any bruising, deformities, making sure to look at the bilateral toes for any discoloration. I'm just going to palpate your ankle. Down the foot, feeling the metatarsals, and the phalanges down here, bilateral toes, starting posteriorly, feeling the tendons, the Achilles tendon, going laterally to the ankle, and the insertion sides, going down to the posterior or anterior foot. Any pain or tenderness?
No.
Going down the patient's toes. Assess pedal pulses. I was noting the temperature of the feet for range of motion. Can I have you flex down and then up, and then for your other leg, down, perfect, up. That's dorsiflexion up and then plantar flexion down. And then can I have you move your ankle inwards? Perfect. And that's inversion, exversion, go out. And then perfect. Awesome. Inversion, exversion, or inversion, eversion, intact. Next, we're just going to move on to the spine. So I'm just going to inspect the spinous process, looking at the symmetrical landmarks at the bilateral scapulas here, making sure that they're symmetrical. I'm just going to start palpating down the spinous process, noting any abnormalities, any curvatures, masses, noting any lesions. Perfect. And go on this side. Can I have you bend down for me? Starting at the iliac crest. Following the spine's curvature, making sure that it's straight. The paravertebral muscles. Looking for any rotoscoliosis. Perfect. And for range of motion, I'm just gonna have you, I already had you flex over and touch your toes. I'm just gonna have you extend your back, go backwards for me a little bit. Perfect. And to right here, can I have you bend from to the left? And then to the right. Perfect. No pain with those?
No.
To keep your feet in place, and then I'm just gonna have you look behind you on one side. Perfect. And then on the other side. Awesome. All right. Good. All right, that concludes our focused musculoskeletal assessment. Do you have any questions or concerns for me today?
Nope.
All right, the doctor will be in to see you shortly. It was nice to meet you.
Nice to meet you.